So recently we initiated a pilot project, and it was really to fill a void that we've been struggling with in our organization for a long time. That it's the understanding of how our decisions impact our patients and our organization, and that struggle really is specifically around data. So we created a strategy to develop this pilot that would deliver real, meaningful, relevant data to our stakeholders and our decision makers. And we wanted to do it in a way that it was in a single platform for them to use. And we wanted it to be done in a way that if it was successful, we could extend it to other procedures or other service lines. Our goal was to get the right data to the right people in the right way so they can make the best decisions. So in healthcare, we've always looked at outcome data. We've always looked at cost data, utilization, quality. We've got more data than we know what to do with, but it resides in different places. We pulled data from our ERP, so that's our item master, our PO data, all the way down to the detail of item descriptions and unspec categories and things like that. We pulled the consumption data from our inventory point of view system, so we know exactly what was used on what patients at what time and what room and by which doctor. And then we also enhanced that with our quality and outcomes data and also our financial data, so we understood the full picture of how all that played into our revenue and our total contribution and operating margins. I think when you start integrating, 4, 5, 6, I didn't count, but 6 or 7 different systems into one place, that the integrity of your data, it has to be accurate. So you have to have the resources dedicated to that effort. Good data in, you get good data out. Bad data in, we understand where that goes to, and it just becomes more complex the more you're trying to integrate. We actually engaged SupplyCopia to build out our platform, and our approach really was to engage our stakeholders, the stakeholder group, to understand what information was valuable to them. We were responsible for obtaining and validating that data and then making it available to SupplyCopia so they could actually integrate that and enhance that data. We've always been driven, have always wanted to incorporate, cost, quality, and outcomes. We want to get a holistic picture. I think this initiative has provided us a way and a platform to actually do that and to do that more effectively and efficiently. Values defined as outcomes divided by cost. And if we look at cost alone, that's not a good indication that we're actually bringing value to our patients or to our organization. We've always wanted to have that complete picture in VA, but it has been somewhat difficult because those measures for success are either hard to identify or it's hard to get the data to prove what it is that we are actually trying to do. I think this initiative, the CQO pilot around joint, does change the way that some of our physicians are engaging with us. And I think the more that we do these initiatives or these type initiatives, the more engagement that we get. Everybody realizes that we're actually all after the same thing. And when we are sitting in our different roles in different buildings without the organization, or, we have our different segments of work, it's hard to see that at times, but when you all get to the table and you realize that we want the same thing, we want to deliver excellent care to the patients, the best care possible, and we want to do it in a way that is cost effective so we can continue to provide excellent care to our patients. I think the tool did exactly what we intended it to do. It brought all the information together, and then it raised questions and gave us some answers. The dashboard itself has a page for each physician, so they have their own specific page. This is where we get to see everything in one view with respect to cost, quality, and outcomes. So a physician can log in and they have the ability to see, how much did this case cost me? How much was the charge to the insurance? How much revenue did we actually receive? What was the direct, indirect cost of that? And how does that translate into a contribution margin and ultimately the operating margin for those procedures? And then they can see that with respect to all of the demographics of their patients as well as their outcomes. So It actually takes all that information and then rolls it up into a single score to help them understand at a high level, how well they are doing in this space. The advice I would give is to be bold and initiate that engagement with the physicians and your organizational leaders. Expect that you're going to have different opinions, and that's perfectly okay. But, change will happen once everybody gets to the table and has those conversations and everybody realizes that we all want the same thing. We want to provide excellent care. We want to provide, the newest, best technology. We want to provide everything that we can to deliver that care to our patients, but we want to do it in a way that we get rid of that unwanted cost.